From the PEP Radio Newsroom, this is the Hourly News Blast. LGBTQ Nation is reporting after 2 decades, the U.S. will end a life-saving HIV prevention and treatment program in South Africa, a country where over 8 million people live with the virus, about 12% of its entire population. The Trump administration said it's stopping the funding because South Africa hasn't done enough to meet the U.S. president's policy requests, including stopping a non-existent anti-white genocide. The head of the United Nations HIV agency has warned that ending the U.S. funding will cost lives. The U.S. State Department said the country will be removed from President's Emergency Plan for AIDS Relief, or PEPFAR, because it failed to make demonstrable progress on policy requests by the administration, the New York Times reported. South Africa receives $400 million annually from PEPFAR, making up around 17% of its annual HIV response funding. The current U.S. administration has previously called on the country to repeal its laws, allowing the government to seize private land without compensation and to exempt American companies from Black empowerment laws meant to address economic disparities caused by statewide apartheid. The administration has also asked the country not to align with U.S. foreign enemy countries such as Iran. Trump has also previously criticized the country's anti-genocide case against Israel in the International Court of Justice and accused South Africa of fostering an anti-white genocide through the government. Human rights organizations and independent analysts have said there's no evidence to support the president's accusations, PBS reported. While South Africa received about $456 million in U.S. HIV/AIDS funding in 2024, it dropped $213 million last year, partly due to the president's dismantling of the U.S. Agency for International Development. Last year, South Africa announced a $45 million emergency fund to make up the funding gap. Although the PEPFAR funding didn't purchase HIV medications, last year its funding helped support over 15,000 nurses, counselors, and pharmacists, and also HIV testing, prevention campaigns, treatment, monitoring, and community outreach programs through health clinics in 27 districts with the highest HIV prevalence rates, according to Foster Mohale, a spokesperson with the South African National Department of Health. Dr. Kate Rees, public health medicine specialist at the Inova Health Institute, a non-governmental organization, said the cuts will impact children, adolescents, and young people, as well as the most at-risk populations, including men who have sex with men. Though the official funding freeze hasn't reached South Africa yet, Mohale said the ending of PEPFAR support isn't entirely surprising since the cancellation of USAID financial assistance last year. Current funding is expected to run out in September, the Associated Press reported. UN AIDS chief Winnie Byanyima urged the U.S. to consider a planned transition rather than a sudden end to all funding, which would risk reversing progress the country has made in its fight against HIV. Please do not take money away because you are taking lives away, Byanyima said, according to the BBC. And that's the News Blast for this hour. The PEP Radio YouTube channel has news updates throughout the day. Be sure to subscribe to keep informed. PEP Radio is available on the Live 365 app, the PEP Radio page at paequality.com, Roku, Alexa, and wherever you find streaming radio. Up next, we have the Meadville area weather forecast here on PEP Radio.